Good afternoon, ladies and gentlemen. My name is Tammy Dickey, and I am coming before you today as an advocate for the Accountable Communities for Health, ACH. The goal of ACH is to achieve improved care at much lower cost without lowering the quality of that care. There is a growing amount of substantial information that shows that with the help of state and federal agencies, community-based programs can actually successfully help people with changing unhealthy behaviors in order to prevent chronic conditions as well as infectious diseases, which will, in fact, lower the cost of care. This is where the ACH comes in as a model of intervention. A promising state policy that combines state healthcare delivery system and community-based social services in order to create a community that encourages healthy lifestyles for those within the community. A community-based program that is already in place that can be used as a foundation for the ACH is state-run public health agencies. Public health agencies can help the ACH partner with other community organizations in order to reach the most vulnerable within the community. Provide community-based services and surveillance services, and to help promote services that will improve the overall health of the community. One of the health issues that this new policy hopes to address is the cost of care. Most people cannot afford to go see the doctor and only do so by going to the emergency room, but by then, sometimes it's too late. Even then, follow-up appointments are usually never made due to lack of funds. Even with the implementation of the Affordable Care Act, ACA, millions of people are still without health care coverage due to the high cost of health care. So, with the assistance of the nationwide service such as ACH, it is our belief that more individuals will be able to see medical professionals when they are in need of services. Even more so, it is our belief that prevention is always much more effective than treatment. However, the issue of treatment must be addressed also. Many people go about their daily lives with untreated and deadly chronic conditions that they are unaware of, such as high blood pressure, high cholesterol, and diabetes, due to the high cost of health care, so they are unable to see a professional in order to get diagnosed. Also, for those that are aware of their condition, they are unable to receive the regular care that they need in order to manage these conditions. The ACH not only hopes to improve the lives of the millions of people living with these conditions, but also help community members in pursuing healthier lifestyles so they never get these conditions to begin with. In order to achieve this nationwide improvement of health, healthcare needs to join forces with schools, businesses, and other community organizations in order to bring together everyone to form a powerful affiliation and share the responsibility of dealing with the various principles of healthcare. Currently, there are 4 states involved with the ACH initiative. These states are California, Minnesota, Vermont, and Washington State. With some of these programs beginning last year, a few this year, and some to begin next year. Many are hopeful of the positive outcomes that the trial models will show. As these 4 models of ACH emerge, constant evaluation is important, as these models may end up having a significant role in implementing other ways of delivery and payment reform. The Centers of Medicare and Medicaid Innovations, CMMI, is the federal program that is funding these selected communities. These models created by CMMI forces its resources on the community focuses its resources on the community while leaving a minor role for the state. Even though the ACH is driven by the community themselves, the state plays a crucial role in development, sustainability, and the scope of the programs. The state itself will bring important backing to the table. And then, by establishing its framework, it will get it started. It will also support local innovations as well as assisting the ACH to spread statewide. Now, I know one of the main questions on everyone's mind is about funding. Since this is a community-based program, much of the funding will come from within the community itself, from various businesses within the community along with various fundraising activities. It has been proven that businesses and individuals give more when the donations are going back into the community for the improvement of their community. As for government money, to help with these programs, it will only cost roughly $300,000 per year per state. Not much money to come from the government, since most of it comes from the community. But we must look at this as an investment in our future. Not just our future, but the future of our children, our grandchildren, and the many generations to come after. By investing in more preventative measures of medicine, we can save a minimum of $4 million per year per state. For example, heart disease and stroke is one of the most leading causes of death in America, costing America $314 billion per year. Those at risk of these conditions are people with high blood pressure, high cholesterol, and diabetes. By reducing the number of people with these conditions, we can significantly reduce the number of people dying with these conditions, heart disease and stroke. Most chronic conditions are caused by smoking, inactivity, and the lack of information. By simply educating the public by the dangers of smoking and the dangers of not enough physical activity, along with smoking cessation programs, also education on eating right, and then helping those in need have access to healthier foods, can greatly reduce the numbers of individuals with these chronic conditions. Roughly more than 170 million people suffer from one or more of these chronic conditions. And about half of the deaths in America are caused by or are due to the effects of these conditions. So essentially, by reducing the number of individuals with these chronic conditions, we can save this nation millions, if not billions of dollars in medical expenses. By adopting this policy, we will not only save the nation's billions of dollars in healthcare costs, we can save millions of lives. The policy will help everyone in need, those in our nation regardless of income, race, or socioeconomic status. By getting the communities more involved with public health care, everyone will be able to work together to get themselves and everyone around them into a healthier place in their lives. As we all know, when individuals feel better and are healthier, they in turn become more productive members of our community. Communities will once again be able to thrive and flourish. Everyone wants to live a long, healthy, happy, and productive life, but we cannot do this if we're sickly. Healthy people work harder, so there will be an increase in job productivity. The more people work, the more money they will make. The more money they will make, the more they are able to spend within their community. The more money spent within a community increases the economy within the community. As the economy of even just one community increases, it begins to spread out to other communities. In time, this will lead to a better economy for our entire nation. A nation of healthy individuals with a prosperous community will grow in many ways and make this great country even greater. Thank you for your time and attention. I hope you all have a wonderful day. Thank you.